So imagine being 14 or 15 years old and already managing chronic conditions like obesity or type 2 diabetes, and now you're being offered medication as adults like to describe as life changing. And that's not necessarily hypothetical. Hopefully, that's where we'll be headed soon. And this talk today is primarily going to focus on tirzepatides, which are commonly known as Zepbound and Mounjaro, and asks whether they could be a viable treatment option for adolescents. And personally, I'll be comparing two approaches to research: independent researching and using ChatGPT while evaluating credibility using the CRAP method coined by Blakesley. So, for those that don't know, tirzepatide, which is commonly and commercially known as Mounjaro and Zepbound, is a dual GIP and GLP-1 receptor antagonist currently approved for adults. And it's increased interest in pharmacologic treatment for metabolic diseases. And my question today is tirzepatide a safe and effective treatment option for adolescents with obesity and or type 2 diabetes? And personally, I'm interested in this question because adults are still developing physically and hormonally, and decisions like this typically require long-term medication exposure and tapering and weaning and a lot of instruction and guidance. And professional guidance on pediatric obesity treatment is very important, and the role of evidence-based interventions and the importance of careful risk-benefit assessment is important. And to research this question independently, which I have already done, I have tried to prioritize things like peer reviewed evidence, clinical evidence, registries of trials, and regulatory guidance. And I used academic databases like PubMed and EBSCOhost and found controlled trials that were randomized and systematic reviews of those and independent reviews. And I also, as well, use clinicaltrials.gov to find pediatric studies that have already been done to help find their endpoints, the criteria for inclusion, and kind of the timelines and everything about them. And I've also looked at FDA documentation and labeling warnings and et cetera to kind of view the regulatory status about pediatric study commitments, because these things can vary based on the study of what you're doing. And also looked at the professional guidelines like the American Association of Pediatrics obesity guideline to contextualize the use for pediatrics to see if it was appropriate. And I searched using terms such as tirzepatide and adolescent or pediatric and obesity or type 2 diabetes. And I also filtered it to make sure they were human studies, just to be sure, publication dates and levels of evidence. And I discarded sources that lacked citations, didn't describe their methods and limitations, and were also opinion based, because typically in this field, you'll find more opinion based things based on you don't think kids need this, or you don't think people that are under 18 need this. And this was effective because it did emphasize authoritative sources and let me evaluate their methods directly. And one weakness of it, though, would be the time cost of searching, paywalls, which I did experience on certain websites, and the possibility of missing relevant evidence if I didn't search correctly, which could definitely happen. And what I did next, I asked ChatGPT to provide an outline and sources for the research question. And ChatGPT was helpful for quickly organizing the sections, such as like categorizing them in backgrounds, evidence, safety, status, ethics, and suggesting where to look next. In evaluating response, I did use the CRAP test coined by Blakesley again, which is currency, relevance, authority, accuracy, and purpose. So with those results, the currency, from what it had told me, is because pharmacotherapy changes quickly, current trials and regulatory updates matter. Any AI summary must be checked against the latest primary sources, such as trial registries and FDA documents. For relevance, a strong response will stay focused on adolescents and tirzepatide, especially in the evidence for obesity and pediatrics. And for authority, ChatGPT is not an authority source. However, it can point to authoritative materials like peer-reviewed trials, documents, and guidelines, like I did find in the AAP and clinical trials. And for accuracy, AI can unintentionally, it'll sometimes miss the nuance of the situation or oversimplify results, which having to go back through, and for the accuracy, you have to typically verify your claims or make sure it cites it rather than just using its wording. And the purpose of it is for assistance and speed, and it doesn't necessarily judge the study quality unless it's prompted to. And bias can appear in both independent research and AI-assisted research. I will say that attempting to be unbiased in this was a little bit difficult, as choosing this topic I have already written multiple papers on before. It was a little bit difficult to stay unbiased, but when researching independently, I did have encounters with confirmation bias and selection bias and publication bias, especially confirmation bias. And it's difficult to stray away from that as a person because you will intentionally, sometimes unintentionally, find things that are searching for your results. And using ChatGPT, bias can reflect patterns in its training data in the way it is confident, which kind of makes an authority effect, such as if you're giving ChatGPT a prompt saying, I need you to find research on the studies of why X is good for Y, it will typically try to find things that will suit towards what you are looking for. And to limit that bias, I used a lot of databases, conflicting evidence, prioritized my primary sources, checked the funding, and applied frameworks like CRAP. And healthcare topics like this and the adolescent use of Tirzepatide, the research method is very important. Independent research, especially from what I have seen, provides a lot of depth and credibility, while ChatGPT will help with the speed and structure. And personally, I do believe that when you're using both of those responsibly and with significant verification and getting into those sources and making sure that nothing is made up or making sure the sources are credible, I do believe that both of those approaches can support stronger academic work when used in tandem.